Hi, everyone. I see the numbers still ticking up as people join, so we're going to give it just a minute or two. Okay, we're going to go ahead and get started. I'm going to use the first few moments to turn it over to our Spanish language interpreter so that she can give some instructions for our participants who need access in Spanish. And then we will come back and do the announcement so that everyone has access to the same information.
Thank you so much. Hi, everyone. Good morning. It's a pleasure to be here with you all. My name is Brittany. I will be your Spanish interpreter. I will provide instructions in both English and Spanish on how to access the appropriate channels. For those that only speak English, we may have some Spanish participants, and we invite you to please join us on our English channel. Once the function is on, which will be turned on right after I'm done with the announcements, please locate the three dots on the bottom of the screen where it says more, or you may see a globe icon at the bottom of the screen. Please go ahead and click on it. You will see language interpretation. We invite you to please select English and then mute original audio so you don't hear the voices at the same time. If anyone chooses to participate in Spanish, you will be able to hear the live interpretation into English. If you do have any technical issues, please let us know and we'll be happy to assist. I will now repeat the instructions in Spanish. Muy buenos días todos. Es un gran placer de estar aquí con ustedes como su intérprete. Mi nombre es Brittany. Quisiera proporcionarle instrucciones de cómo acceder al canal de español. Por favor, ubique los tres puntitos a donde dice more o más. Y también, o también puede buscar el icono terráqueo ahorita que se encienda la función. Le invitamos que por favor presiónelo, busque Language Interpretation, después va a buscar Spanish o español y asegúrese de que seleccione Mute Original Audio y después va a poner Done o finalizar. E igual manera voy a poner las instrucciones en la cajita de diálogo en caso si ustedes necesitan instrucción. Muchas gracias y disfrute. I will now turn it back to you. Thank you.
Thank you, Brittany. Hi, everyone, and welcome to the Healthcare and the ADA Inclusions of Persons with Disabilities webinar. I'm Jerry Davison from the Pacific ADA Center. I'm going to be going over some announcements. The moderators for the Q&A and chat portion at the end are Stacy Kernison from the Southeast ADA Center and Jan Garrett and Savannah Bradley from the Pacific ADA Center. This is a series of webinars brought to you by the Pacific ADA Center on behalf of the ADA National Network. The ADA National Network is made up of 10 regional centers that are federally funded to provide training, technical assistance, and other information as needed on the Americans with Disabilities Act. You can reach your regional ADA center by dialing 1-800-949-4332. So sorry, 4232, and that number's on the slide in front of you as well. Advance to slide 2, please. Also, I'm seeing some questions about the PowerPoint. The video from today's recording will be posted on our YouTube channel. It typically takes about a week for us to get that, make sure the captions are accurate and everything, but that will be available to everyone. Okay. Real-time captioning is provided for this webinar. The caption screen can be accessed by choosing the closed caption icon in the meeting control bar. Next slide, please. In our sessions, only the speakers will have access to the audio. So that you cannot talk unless you are given, unless you raise your hand and you unmute. But we're only going to do that if you need to do it as an accommodation, because we found that it takes a lot more time than to just get questions from the chat. So if you do need help listening to the webinar and you're not able to get sound, you may want to dial in, and that number is available. It's 1-669-900-9128. And the webinar ID is 878-4672-0635. This is not a toll-free number. Next slide, please. This webinar series is intended to share issues and promising practices in healthcare, accessibility, and people with disabilities. The series topics cover physical accessibility, effective communication, and reasonable modification of policy issues under the Americans with Disabilities Act, the ADA. These webinars typically occur on the fourth Thursday of the month. And by being here, you are on the list to receive notices for future webinars in the series. And they typically go out 4 weeks before so that we can open up to registration. At the conclusion of today's presentation, there will be an opportunity for everyone to ask questions. You may submit your questions using the chat area within the webinar platform. Those questions will only go to the host and the speaker they will not go out to everyone. We probably won't get to all the questions, but we will try and ask the ones that we think are most relevant for this audience. You can always reach out to your regional ADA center afterwards. Let me make sure I'm covering everything. Yes, so type your questions in the chat. As you can see, it goes to the panelist. You can also press Alt-H and enter text in the chat area if you need a keyboard shortcut. If you're listening by phone and not logged in, you can email adatech@adapacific.org to get questions answered outside of the webinar. Okay, let's see. Next slide, please. Okay, thank you. Sorry, you're already on it. If you experience any technical difficulties during the webinar, send a private chat message by tapping in the chat window. You can again use that same Alt-H to access the chat via keyboard keys. And then there's also the email address that you can email separately outside of the webinar, adatech@adapacific.org, or call 510-831-6714. Those are not going to be the best ways to get to us during this webinar, as we are attending this webinar and not likely to be able to respond quickly, so the chat will be the best way to get in touch with us. Next slide, please. Okay. I am going to introduce today's session. The session is titled Unleashing Service Animals, Best Practices in Healthcare Settings. The ADA sets clear rules for service animals, yet real-world application in healthcare is rarely one size fits all. This session will go beyond the 2 allowable questions to examine the policies, procedures, and practices across different settings. Today's speaker, Laura Lee Putzbach, is the Executive Director of the Service Dog Alliance, Inc., an all-volunteer nonprofit promoting safe, unfettered access for service animal handlers. With 30 years 30 plus years in health and human services. She provides community education to implement practical ADA compliance strategies. She is co-facilitator of the Florida ADA Coordinator Network and a member of the ADA National Train Leader Network. Laura Lee is a certified ADA coordinator and has a Bachelor of Science in Human and Social Service Administration from Bellevue University. And I'm going to start with one question that Laura Lee asked us to ask so that she could get a sense of the audience. If you could put in the chat right now whether you are a provider, you can just put provider. You just need to say that one word in the chat. Or if you are a service dog owner, you can put that in the chat as well. But we're trying to get a general idea of where most folks stand. And Laura Lee, just so you know, I am seeing that the vast number of folks here are providers. There are some service dog owners in here. Also, I see some nonprofit staff and advocates in here. And then some are, yeah, I think most of those cover that. Some are government agencies and some are architects, some are SIL directors and higher education staff. So, but the vast majority are writing providers. So hopefully that gives you some idea of your audience. And I am going to turn it over to you now.
Thank you for that great introduction. I just want to highlight a couple of things. Service Dog Alliance primarily does technical assistance and training, and we will help individuals by walking alongside them when they have a barrier to access. The other way we get information is we are part of the Facebook community of service dog handlers, so a lot of our stories come from other handlers. The most important thing about today, this is our warning. Medical conditions or diagnoses are going to be talked about today. It is for illustration purposes only. You must not discuss them or consider them when you're determining if it is a service animal, okay? Because that'll get you in trouble. I am a geek, so you're going to see some court cases related to healthcare, some settlement agreements, and some sample policies. These are all listed in the appendix, but during the presentation, I may reference them so that you can go back and look later. Sometimes in your organization, they want to know, well, I know she said it, but where is it coming from? So today we're going to talk about the laws that apply, where service animals can go, what to screen or exclude, and we're going to do that briefly because that's really the gatekeeping function, and that's a basic, and this today is intended to help you get past how do we let them in to what we do when they are in, and how we integrate service animals into healthcare, and when do we need to document. So the iceberg picture here is really the symbol of policies. That's the smallest piece. That's the minimum. That's basic. If you have the question, do I have to have policies? There is nothing in the law that says you have to have policies. What I will say is if you have an interaction with an administrative agency like DOJ, the first thing they're going to require you to do is put your written policies in place. The procedures, I believe personally, are separate than policies. They're the how do your staff take action to make sure your policies happen? And then the practices are what our people do despite having policies and procedures. And that typically is where we see most of the issues arise. We're not seeing anymore you can't come in as the highest volume of call. It's some of the more subtle things, and that's what we're going to talk about today. So policies, procedures, and practices. Here's the aspiration. We want an inclusive organizational policies that comply with the law, ensure the timely delivery of competent care while actively considering each patient's clinical conditions, needs, and preferences. These would be policies that aren't any different for people who don't have service dogs. The photo here is of a service dog handler at the top of a mountain. And their goal was to one day get there. And they accomplished that. And I am confident after today, you're going to go back to your organizations and your patients are going to get exceptional care, because this is about balancing the ADA law, which is a minimum standard, and great customer service. So let's talk about what laws apply. What you have here is a graphic, and everybody lives somewhere. And so we're talking about assistance dog laws. So the Fair Housing Act would cover that. And we'll talk briefly about that because of long-term care. The middle circle is public access. You might be a state and local government, Title II, it could be a health department or a community hospital that's run by your local government, or you could be a private facility, a Title III, or you could be receiving Medicaid and Medicare funding, and so the Rehabilitation Act will apply. So it's important to know what laws apply because more than one can. The picture of the United States represents, in addition to federal law, what we now have are states adding to the federal law. So federal law has to stand and states can do anything additional. So for example, every state but Hawaii has a service dog and training law. 2/3 of the states have rules about denying, interfering, injuring, or killing a service animal. And about 50 states have fraud statutes that talk about it's a crime to misrepresent. In the reference, there is a link to the table of laws. I encourage you to look at what's applicable to you where you are, and that should help you because not every state has made the same law. We will briefly talk about employment, but very briefly, because that's a whole nother conversation, but it does play into the care of patients. And we're not talking about airplanes today. So when I think about healthcare, when I first started out in my journey, I thought they were the place where I would see no animals, and it would be a big deal. This chart represents how many different types of animals we actually see in healthcare facilities. So we see service animals. Emotional support is an ESA, also known as a companion or comfort animal. We see therapy animals, which are trained to make people feel better, but they're not for a disabled person. We see facility dogs, often called animal-assisted therapy. There are compassionate care programs when folks are at the end of life and the hospital makes an exception and they can bring their own pet in. And there's even one more category I didn't add. If you're a research hospital, you're going to see some research animals. So for that reason, it can be very confusing to the staff who have to implement all of these policies. The ones we're going to focus on today are service animal, that I have to have a disability. It's trained to assist me and specifically my needs. That typically anywhere I go, the animal can go because it's a modification of the no pet policy. The ESA, we're going to talk a little bit when we get to long-term care, because when a person becomes a permanent resident and it's their home, then some housing laws may apply. Otherwise, everything else you should separate out your policies. And I will tell you the story of a hospital that I had been to repeatedly, and they couldn't understand why they kept having complaints. I talked to the staff and there was training. And I said, well, let me see your policies. And what happened was their policies were animal policies. And you'd be talking in one paragraph about service animals and you did this, but you asked for the ID for the therapy animal. And oh, they had to have vaccine records. And so in reading back and forth, it wasn't clear which animal we were talking about. And so I always encourage separating out the policies that you're required to comply with. Service animal, obviously. And if you are in the long-term care business and that becomes your residence, then those policies. Otherwise, separate them out. A good example is Texas Tech Ambulatory Clinic policy that's at the end. They allow ESAs and they have a policy for that. UNC has a policy, but it refers to a separate policy for patient care for animal-assisted activities. And the University of Illinois Hospital has a separate policy for their pediatric clinical care animal-assisted therapy program. So again, how you organize is going to affect the quality of implementation. So for those of you that this is a new topic, we're going to briefly go over what a service animal is. We start with assistance animals because everybody lives somewhere. Service animal can be any dog, any breed or size. It is specifically trained to perform work or task to mitigate the person's disability. It can almost go anywhere the public is permitted. Under that, you see a picture of two red animals. One is a large red standard poodle, and the other is a miniature red service horse. And we'll talk about service horses in a minute. And you can see they're not too far off in size. On comfort animals, companion animals, emotional support animals, abbreviated to ESA, it could really be any animal or species. They may be trained or untrained. Access is really limited. When we begin to talk about long-term care, a service dog in training is really going to fall into that category unless the state has service dog in training rules that give them the same rights as the service animal. So what's the key? They have a job. They do tasks or work that equals an action, not a feeling. So in the top, we have all of these pictures. First of all, disabilities can be visible and invisible. It is the action that is individualized for the person that makes it a service animal. The same work or task may be used for different medical conditions. So don't make an assumption, oh, they must have a psychiatric condition because the dog did this. So for example, in the top left corner, the dog is pawing the person. This could be a reminder to take their meds. It could be an alert to an upcoming situation like the oncoming of a migraine or blood sugar. It could be a reminder to stop the behavior, picking skin or eating their hair. Below is a picture of a person sitting on the ground and the dog is draped over the legs. This may be because the person is not safe because they're at risk of fainting and the dog has been trained not to let them up until they are safe to get up. It also could be applying pressure points for pain relief, to reduce anxiety, or to provide heat because their condition causes the skin to get really cold, which makes it hard for them to be mobile. So we can't assume what the task medical condition is for. We just know the dog has a job. The job is an action, not a feeling. And so you have some other pictures of the dog in the sling. Likely they're close so they can breathe the breath and do some scenting. Dogs help pull clothes off, getting dressed. And the right two pictures, the dog at the top is helping the person stand because they're locking their legs, they're bracing, and another mobility task might be pulling the chair, the wheelchair. So miniature horses are an exception to the rule. What I like to say is they're about the size or a little larger than a Great Dane. The same rules that apply to service animals, including being housebroken, apply to the miniature horse. The difference is the business has to consider if they can accommodate the type, size, and weight of the horse. So here you see Flirty the miniature horse. She went with her handler to the doctor's. She has more flying miles than I do, and you can follow her on Facebook if you're curious about how miniature horses operate. It's pretty fascinating. So typically, healthcare settings have a no pets policy, but we saw that may not be true because there's a lot of animals in there. But under the ADA, a reasonable modification allows service animals. And for those of you whose bosses want to know, well, where do I find that? I've given you the section for Title II, for Title III, and the Rehabilitation Act. So Title II is if you're a state or local government agency. Title III is if you're a public accommodation. So public accommodations are like banks and gyms and doctors' offices and hospitals. And the Rehab Act is if you are receiving federal money. And those will be important as you decide what your policies are. They're similar, but worded differently. So now let's talk about where a service animal can go. We receive more inquiries on this topic than how to screen if it's a service animal. It's important to remember public accommodation laws are no different for healthcare settings than banks and gyms and stores and even movie theaters. So you're all lumped in together. There's no special exception. What makes it different is how you do your self-evaluations, and we're going to give you those tools today. So a lot of times organizations like to benchmark policies, and you go out to the internet and you talk to your colleagues, what are you doing? So that's what I did for today. I went out and I found some policies, and we're going to talk about them. So here's our first poll question, and in the chat room you can put your answer. The first question is the service animal policy compliant? So this is what it says. The service animal cannot enter certain areas for safety and infection control. They can't go beyond the waiting area in the dermatology clinic or beyond the waiting area in the dental clinic. They can't go in operating rooms and preoperative areas. They can't go invasive procedure areas. They can't go in inpatient rooms unless the service animal is part of a treatment plan. They're not going in decontamination rooms or sterile processing and storage areas. And they're not going in areas where personal protective clothing is worn. So what do you think? Put in the chat. A, the policy adheres to the service animal exclusion rules. It doesn't apply to those rules. It depends, or you're not sure. And there's no wrong answer because we're all learning together. So what do you think? Are we seeing anything in the chat, ladies?
Yes. Well,
Oh,
go ahead.
sorry, Jerry. We're seeing a mix of everything. So,
Okay, well, this is good because I haven't told you what the guidelines are. So here's what I will say. We're going to go through these today. For me, just looking at this at face value, there are three, I would say depends because I want more information, and you're going to find in the ADA world, depends is an answer you often get. It's not black and white. I would want to know more about the dermatology clinic, the dental clinic, and the inpatient rooms. And we'll talk more as we go along about why that is. So there are three reasons in the law to restrict or exclude. The first two are related to Title II and Title III and Section 504, which are all related to public access. And the last one on the slide is related to Title I or Section 501 and 3, which is related to employment, which I said we'd talk about briefly, but I wanted to give you all of the reasons a person could be excused. So the first one is they fundamentally alter the nature of the service or program or the goods or the facilities or the privileges or advantages or accommodations. So it's doing something that changes how you're doing healthcare. The second is direct threat. There is a significant risk to the health and safety that cannot be eliminated by a modification of policies, practices, procedures, or by providing other auxiliary aids or services. This is going to be the core of what we talk about today because it comes down to good faith judgment in evaluating individual circumstances. And the undue hardship is in employment talks about a difficulty or expense of giving the employee the accommodation. And as I said, we're not going to focus a lot on employment, just briefly. So here is an example in a healthcare setting of a fundamental alteration. This, we have great partners in the community that let us go and take pictures. So this is at our local hospital. They have a hyperbaric oxygen therapy chamber that is used for wound care. In the first picture, you can see the service dog standing outside the machine. There's a patient inside and there's a nurse on the other side of it. In the second picture, you see the nurse talking on the phone because there's no way to communicate other than by phone into the chamber. And the machine is not designed to put the dog in with the person. That's what makes it a fundamental alteration. It's not designed for the dog to use it. So I get asked often, well, why can't the dog be in the room? Well, in this situation, there are 3 chambers. It's a small room, and there's no room to safely load other patients. There's no way for the handler to intervene if something needs to be done with the dog. And you can't immediately exit from a chamber. It's a decompression process. Think scuba. So this is probably one of my favorite examples of fundamental alteration. So now let's talk about direct threat. So it has to be significant to the health or safety of others, and it can't be eliminated. This is where we get to be MacGyvers, because some things really can be eliminated. You must do an individual assessment. You're going to look at the severity and duration of the risk. Will injury likely occur? And what could be done so that it wasn't a risk? You can find the direct reference listed here in the Title II, Title III, and federal guidelines if you want to be from the Show Me State. In the Stanford policy, it adds in their policy the risk to the animal is also considered a fundamental alteration. So that's a nice sample. So then we have CDC guidelines. So we have the ADA, and then we have CDC guidelines that help healthcare make determinations. There's no evidence, according to the CDC, that animals pose a greater risk than a person, so there's no reason to exclude them. And this can be found in your CDC guidelines. So directly from the CDC guidelines, there are 3 primary ways you can evaluate risk, and that's the environmental risk. I want to start off by saying that is my service dog wearing a purple mask. There was no dog hurt in the provision of this photo. It was for illustration purposes only. You cannot put dogs on masks. That is actually in the CDC guidance for handlers for service and therapy animals that had to be put in writing by the CDC during COVID. But let's get back to the criteria. You're having to create environmental criteria to minimize the risk of disease. So we're normally talking about airflow there. So you have positive and negative pressure rooms, sterile cores, a lot of hand washing and absence of dermatological conditions might be a reason that you're going to exclude a service animal. And then the protective equipment. People are wearing gloves, face masks, protective eye gear, face shields, but it's normally done by all parties going into the space. UNC policy has a section on an animal exhibiting signs of infection. So they're actually looking at when an animal is determined a risk because they're showing signs of infection as a sample. So basically, this is the question that most providers have. Where can service animals go? The other language that the DOJ and ADA find helpful is they say generally, because that is the out. It doesn't mean always, it means generally. So generally restricted from an operating room, it's sterile, or a burn unit, or rooms requiring special ventilation, designated immunocompromised treatment areas, isolation rooms, some, not all, ICU units or transplant units. So for example, when my friend had her double lung transplant and my service dog was not able to go in the initial unit when she had first got her lungs. Makes sense because it's a highly specialized contained area to make sure the lungs have no chance of infection, including getting hair or fur. Food preparation areas, and medication prep areas. So there's an interesting article from 2016, and I've listed it here, Caring for Patients with Service Dogs, Information for Healthcare Providers. In that, it tells the story of a 7-year-old who had severe medical condition, and Duke Hospital made an exception. The service dog, the trainer, and the child went in to the procedure room when she was under anesthesia because the dog was able to, before medical equipment, alert to the life-threatening condition, and they were able to intervene. So the ADA is the minimum, and as healthcare professionals, you have to decide if and when help is needed from the service animal. It's not always the case, it's typically rare. So generally restricted, no, we should be able to see animals in ambulances, emergency rooms, waiting rooms, patient rooms, treatment rooms, allergy clinics, which we're going to talk about more, dialysis centers, the cafeteria, the gift shop, nursing homes. So they can go almost anywhere, but it's going to be up to the healthcare facility to make a determination what are the restricted areas. So here's poll question 2. Can the team be provided emergency transportation? What I'm calling the team is the service animal handler and the service animal. The question in the chat, you can put yes, no, depends, or pass. And this happens to be a photo of an ambulance from Indian River County Emergency Services with a service dog standing inside. So what are we thinking, folks? Yes, they can be transported. No, depends, or pass.
We have mostly yes, but we also have some of the other answers. I think the only one we don't have is a pass, not sure, but
Okay,
mostly yes.
so here was the trick question. I asked, could they be provided emergency transportation? I didn't ask if they could go in the ambulance. So let's talk about emergency transportation. Yes, in the frequently asked questions from DOJ, it specifically says yes for the ambulance. There was even a settlement case with Hardin County Emergency Services that said, yes, service animals can be in the ambulance. But here are the caveats. I want you to think about, in some communities, typically larger, they have clinical care transport that is comparable to the trauma center at an ER. We have medevac helicopters. So this is in our community, the medical vac helicopter. So you can see it's a small helicopter. Patients are only going on it with that are critical. We put the dog in there because the dog is not allowed to fly, the service dog, on this flight. And I wanted to do this so you could see the space. So this is the front, and then on the top bottom left, where the dog and the person are, who's going to have to get to care, to that gurney. And then this is the back at the top right of where the gurney is. So there's very little space, and the level of the person's condition, the amount of medical intervention, and the space to safely perform the job, they've made a determination that it's not okay to put the animal on the helicopter. And each organization will have to do that self-evaluation independently. What I will say about emergency transport, if you are doing training, I encourage you to get your stakeholders involved. What we are seeing is that when they do transport a dog, they are transporting the problem to the emergency room. We especially see this in long-term care, where they're not differentiating between an emotional support animal and a service animal, and we'll get the call that the dog needs to be removed because the ambulance driver didn't want to leave the dog alone. So if you have relationships with your medical transport staff or your elder care settings and your urgent care settings, because sometimes the patient is being picked up from urgent care, and relationships with animal control, who likely will be picking the animal up, haven't been made, and so there's a delay in care. So who to screen? Today, our goal was to get beyond the 2 questions. There's lots of trainings out there. We do think it's important, and we do offer them for free. So I'm going to just quickly review, just in case there's some folks on here that haven't had the basics. So documentation to enter is a big one. So this is an actual situation. I'm going to read what the email was the person got. We need the following information regarding your dog. We need vaccination records, certification paperwork, and you stated you trained your dog. We need your credentials as a certified dog trainer. If you can't provide it, please leave your dog at home. This is a sad situation because despite the person's attempts to educate them that this was not allowed to be asked for, they needed to see their provider. They had been seeing this provider for a while. The practice was sold. This came from the new company. The person had to decide, even though they were getting seen weekly, how do I handle this? And so they had to make the decision, am I right? Or do I give them what they want? And even after offering rabies vaccine records, they still proceeded to treat her in the parking lot in the winter for 6 weeks. She filed with a disability state rights agency, and we're watching that case go through. The second situation is an example. Sound Community Services was a settlement agreement in 24. It's the first settlement agreement I've seen address the issue of vaccination records as a requirement for entry. And the other cases there, Del Amo Hospital, OptumServe, and Dr. Bruce Benson, again, go to the fact, no, you can't ask for these documentations. In Colby versus Endocrine Services, this was an interesting case to me. The person was seeing a physician, had diabetes, and they made a referral to an endocrinologist. And the endocrinologist only got 1 lab result for blood sugar and made the determination that since it was normal, the dog couldn't come in. It's really important in healthcare to separate the gatekeeping function from the medical function, because if we had followed procedure, we would have let the person in, and more information about their healthcare would have come as the person was being treated. I have the picture of a service dog ID card. I actually got a ketchup bottle. My ketchup bottle is named Heinz. It's wearing a service dog collar, a leash, and I was able to get it registered. The point is, registrations, they don't mean anything. So these are the basics for service animals in public access. If you're going to train your staff, use this sheet because it's the quickest way to get to the issue of, am I letting someone in? When to ask, what to ask, and when to exclude. We'll go over later the what to ask, And we're going to talk a little bit about what to exclude. So the real issue is you're going to ask if it's not readily apparent what the job the dog is doing. Remember, most worker tasks are for invisible disabilities, so you're going to have to judge that. We're not asking about the disability ever. We're not asking for documentation. We're not asking for demonstration of task. And here's the deal. Dogs can come naked, not the person, just the dog. So they don't have to have any markings that it's a service animal. So here is poll question 3. Can there be a different standard? So the top one, to summarize, they want the rabies vaccine, the core vaccines as directed by the service animal's veterinarian, if they're going to be inpatient, because they're going to have a lot of contact with staff, patients, and visitors during the course of their admission. Versus outpatient, you don't have to show that stuff. Can there be a different standard? Yes, no, or depends. What do people think?
We're getting some no's. And depends. But mostly no's and depends.
Right.
And I think,
And
I'm sorry.
I would agree. I would say depends. And the reason I'm always giving depends, I pulled this policy off of the internet. Maybe there's information we don't have, and they've been able in a case-by-case analysis to make this. But there is no difference between inpatient or outpatient, just like there's no difference between picking up at a restaurant versus sitting down in a restaurant. The law is very clear and one direction. So the other part, actually, I want to go back one. Maybe. So the other thing I want to talk about is I have been asked at numerous doctors' offices to sign an affidavit that attests to the fact that it is a service animal, what the service animal does. And we're seeing that in states, you can't even have them sign that. The entry is separate from the care. So you're only allowed to ask the 2 questions. So the other reason you're letting people is they're under control. Under control means they have a harness, leash, or other tether, and that would be consistent to most municipalities having leash laws. But there are 2 exceptions, and the 2 exceptions allow the person not to use a harness, leash, or tether, but to maintain with control by voice, signal, or other effective means. When I do these trainings, I am always very careful about putting in writing so this doesn't get passed around of what those exceptions are. We are seeing an increase in handlers using the exceptions because they've read about it and they just like their dog off leash. Primarily in the owner-trained younger crowd, they're misinterpreting the intent of the law. So the exceptions are if I am totally disabled and unable to use the traditional harness, leash, or tether. Or if it has a job and for doing its job, it needs to be off leash. So this is Patrick in the wheelchair in the picture with the dog on the leash. Over time, Patrick's disability progressed and he went to a sip and puff mechanism, and it's basically a straw, and his breath is able to push and control buttons. So what you see in the next picture is an electronic collar. It has 4 settings. It doesn't hurt the dog. And so he would put the collar on the dog, and he could communicate, and it would beep, and the dog would know what he wanted and remained under his control. The other example is a person with PTSD. Sometimes entering a room and not knowing what's in there is disabling. So it is not uncommon for a handler to have a trained dog that will actually enter the room, assess the situation, to report back on its trained findings. So it might be there are people in the room, don't go in. There's no people in the room, don't go in. Or to find a seat that's away from people and lead him to the seat. So that would be an example of when it's on the task. So the dog would be off the leash, and once the task is completed, would go back on the leash. The next part of under control is what should we be seeing? We get lots of complaints about dogs on retractable leashes. I don't care what device the dog is using, whether it's a rope, a leash, a tie. The issue is the dog's going to be in that person's bubble. It's not bothering other people. It's not touching things. It's not lunging or barking or soliciting attention. So the top picture, the gentleman is at the check-in counter. His dog is laying calmly at his feet between the wall and him. That's a perfect position, not bothering anybody. Dog's under control. The second picture looks a little wild and crazy. This is actually a demo that one of our board members does. So the dog has jumped up, has its two paws draped over the person's arm, and is with extreme pressure pushing them down. And that sometimes looks out of control, when in fact, it is called a takedown. Some people call it other things. It may be because the handler ignored earlier warnings and they've escalated from a paw to a nose nudge to, you're going to pay attention to me. It may be to get them to sit for safety. They may be having an oncoming seizure or a fainting spell. So don't assume it looks out of control. You can always go and ask, hey, is everything okay? I noticed your dog was jumping on you, and get a response. The other kind of task you might see that looks out of control is a dog herding. It's off leash and it's doing circles around its person. A lot of people call that orbit. They do use other names. And it's done to create separation. It might be a person who has a head injury and bumps into things. And so the dog is blocking that from happening. It might be a person with PTSD or anxiety that's creating spatial boundaries from other people. The last picture is someone laying face down on a medical treatment bed, and the service dog is laying on its side. The leash is still attached. There are sometimes when you get treatment that the dog interferes with the provider being able to do their job. And so as long as the dog, who has been trained to stay out of the way, that's considered under control. It's important that the handler have a conversation with the provider so that they understand my dog is going to jump up when I go to sit up because his job is to come and brace for me when I get off the table. And that's called intelligent disobedience. He's anticipating my needs. So the important part of today is I want you to think about your unique healthcare environment. And this is where I want you to start forming your questions we're going to focus on at the end. Not all healthcare settings are the same. So you can't exclude a service animal because the staff can perform the same job. You can't separate the animal from the handler. That's going to be a very rare safety direct threat reason to do that. You're not going to segregate the animal and the team from others. And we'll talk about when it may be appropriate, but generally you're not going to. The handler is responsible for the care and supervision of the animal. I cannot tell you the number of calls I get from administrators saying, my staff are walking the dog, my staff are feeding the dog, my staff are playing with the dog. Sometimes it's the staff choosing to do that and not the handler asking. And so internally, you have to figure out how you're going to manage when that's happening. Goods and services are for the human, not the animal. Furniture, beds, food. And we're going to talk about that, especially in healthcare settings. So if it's for me, the patient, it's not for my dog. Or the shower. Showers have come into a lot of questions. The treatment focuses on the patient, not the service animal. So when we saw earlier that the dog had to be in my treatment plan, from the ADA perspective, it did not. However, if the dog is going to be incorporated because as a professional, and we'll talk about physical therapy, it would be appropriate. But just to be in my room with me, it does not have to be in the treatment plan. Most important, include the patient in decision making. For those of you that might be watching The Pit on television, that new medical drama, I love that they have a passport and it kind of tells you what's happening. That's really important because there's what I call hospital time. Things move fast, things move slow, things don't move at all. And so being able to prepare if I need someone to have my dog taken because I'm having a procedure that it can't be present will be important. So always communicating what's coming up, what's next. And the hospital may offer more benefits than required by law, but you cannot require participation. The example I'll give, the University of Illinois hospital policy that you've been given, they have in their policy that the patient with the service animal must be placed in a private room. What I will say is that borders on don't segregate the service team from the same service. But if that's your practice, you can voluntarily offer, would you like a private room? And that's a whole issue with billing. We're not saying it has to happen. Just when you read that policy, distinguish between mandatory and voluntary. So up until now, we've been talking about one party covered, the service animal handler and their dog. But we know we don't live in isolation. So what happens when all parties are covered? So if each person has a disability defined by the ADA, you must address each person's accommodation request. The two biggest requests we see are I have a fear of dogs or I have allergy of dogs. That is not a reason to exclude the service animal handler. So the first thing is not every fear or allergy rises to the level of disability. So you're going to have to do that assessment. Duration, severity. You're going to include the person that is saying this, what helps when this happens, and then come up with a plan. And the plan may look different for each individual, but you can't say the service animal has to go. You have to be able to accommodate both the person who has either the fear of dogs or allergies and the service animal handler. So things like cleaning protocols, putting them in separate rooms, looking at appointment times, improving air quality. Those are just a couple of ways you might be able to resolve those things. The Reeves case with intermediate health care is an example. The provider was allergic to dogs, severe allergy, and it went to court and they found in favor of the provider. And the reason was the service dog handler team was offered alternatives. They said, we can't get you in to see this other doctor, but we can make you a follow-up appointment with that doctor. Or if you want to be seen today, what we can do is have you with your companion that came with you, take them to the car or stay in the waiting room and you just come back and we'll see you. And for that reason, they addressed that. In the Bennett case, that was a recent one and it was a nursing student. So this was Title I. In Title I, service dogs are not mentioned. It's an accommodation like everything else. And that's my timer going off, sorry. So there's policies that look at, you'll notice there's some policies in there that look at animals and how covering more than one person is in play. So allergies. Allergies is the biggest issue we have. This is a quote from Eileen Hanrahan, the attorney at the Office of Civil Rights for the U.S. Health and Human Services Office. This is from 2013. I put this in here because here we are in 2026 and we're still fighting the same issues. So what we want to be able to do is, if you're evaluating for a service dog allergy, you need to better make sure you're addressing fragrance allergies, food allergies, so you're not just focusing on one type of allergy and trying to solve that. So we're talking about all different kinds of healthcare. And in the interest of time, we're going here. So poll question 4, which complies with the ADA? Service animals are not permitted during active physical therapy treatment, or they are for ambulation? Do you think policy A is true, that they are not permitted? Policy B is true, they are permitted? It depends, or you're not sure.
We are getting mostly B's, but a few C's in there as well.
Okay, and C would be the answer I'm looking for, because what we're going to do, remember, direct threat, we're going to assess for safety. The dog can still be present, but you may not be ready to incorporate the dog into therapy. So here's an example. On the left is a group physical therapy room, and typically there would be lots of other patients doing other things. We just did a photo shoot, so we wanted to give you a sense of that. Aquatic pool, the dog's not going in the pool, but can be nearby. I will tell you, physical therapy and occupational therapists are my heroes because they are asked to incorporate the service animal because they typically have been involved as a part of the person's life before hospitalization and will become an important assistive device on discharge. Imaging. Typically, imaging, we're not seeing animals in because of the radiation risk. So the first picture here is at the CT scan. The dog should not be in the room. This is a what not to do. The dog happens to be in the same next picture, laying next to the controller in the room. You are not required to allow the service animal to sit in the control room. I will tell you personally, the places I go know my dog, and if I choose to bring my dog, I let them know ahead of time because I want to make sure it's okay. But they do not have to allow that to happen. So if you're a handler, make arrangements. Hospital inpatient settings. So the emergency room. What we're seeing are some of the barriers. Emergency rooms are traditionally restricted access. People are let in, but there are times when there's temporary restricted access. It could be related to the medical severity of what's going on. It could be safety. If you've been in an emergency room on a late Saturday night, it can be wild times. And so to control some of the behaviors of out of control people, they're not letting anyone in, not just the service dog handler. Beds in hallways because there's no rooms. Here's the rule. If you're letting anyone in, you must let the service dog handler in, okay? That's just the basic rule. In the ICU, we are getting repeated complaints that they're being asked to wait in the lobby for hours, the general lobby, and not being sent up to ICU because somebody has to screen them, while all others are being sent up without service dogs and they're getting a more immediate access. An interesting Facebook discussion happened in one of my community groups about labor and delivery. I was impressed that they were thinking about what are the things. I'm going to have a baby. What if this goes wrong and it's not going to be natural, and who's going to take the dog? Those conversations were then planned to be had with the provider. The important thing is, no matter what treatment you're giving, is to make that an interactive process. For long-term care, again, when they become a resident, that this is their home, you need to think of this as their home and how the fair housing laws apply. And the psychiatric hospital. We get asked this a lot. There's a difference between if someone has been civilly committed, which is basically each state's process, and it's 3 steps. 1, the detention, and that may be done by a police officer who makes the decision of what happens to the dog before it ever gets to the facility. We are seeing dogs, service dogs, getting to the facility, and that's the evaluation process and the determination process. Again, you're using the direct threat determination and the fundamental alteration determination. If nobody can have shoelaces, I'm not going to be allowed to have my leash. Can my dog perform in that environment under control without the leash? That would be an example. So you're going to have those conversations. Is it safe? Does it alter the nature? There are cases where the person has been able to be admitted to the psych hospital and take their animal, and there have been cases where they weren't well enough or the nature of the environment was not matching to be safe. So this is question 5, and this is my challenge, because what we're finding, this is the gotcha moment. When facilities really don't want animals, service animals there, this is how they say, oh, they can't be here. So service animal relief, what would you do? And I see there's a typo, but the patient is not permitted to leave the floor, or the patient has assistance to potty the animal 16 hours a day. What would you do? This is a reflection moment. So at the top, there are puppy pads. At the bottom picture, there is a picture of a dog in diapers. And in the center, there's a picture where they've identified a service animal relief area. My challenge to you is don't let animal relief needs be the barrier to access. If cruise ships who don't have great infection control measures and airports beyond security can figure this out, I am confident healthcare facilities can come up with a plan. So, and Stanford's policy actually lists that they have designated areas. The last thing we're going to cover before questions is how to document. The first thing I want to say is most people want to know why. So generally, a person has 180 days to file an external administrative complaint with DOJ, Health and Human Services, Office of Civil Rights, or the state local Human Rights Commission, or even the medical board. So people who are not coming to you may be going elsewhere to say, we had a problem and we want you to do something. Stanford, the policy, they actually have an assessment tool for direct threat. So if you wanted to look at what a form looks like, that's great. The other questions we're getting are, can I permanently ban the dog? Generally, no. Each incident is a standalone. And so you're going to say, I'm sorry, we need to get you to take the dog away. You can stay as the patient during whether it's inpatient or outpatient, and we're happy to service you. But when you begin to see a pattern of problems, for example, if a dog bites someone, you may actually need to exclude that animal, and there's the process of going through that evaluation. On a very rare occasion, and I found this case, Roe versus Providence Health System, the service dog handler filed for discrimination. The judge actually ruled in the health system's favor and said, not only they did not discriminate, we're not going to let you bring the current service animal or any other service animal to their facility ever. That's very rare, so don't think that happens. The last thing we're going to talk about is assistance animal letters. We are hearing providers saying, I don't write them. And so here's what I want to caution you. Are you writing letters for anything else in your practice? If you're writing letters that say they need a shorter workday or they have a lifting restriction, you are writing a letter for a patient. You're not being asked to write about the dog. You're being asked to write about the person's functional limitations. So the kinds of letters you might get asked to write. They want to attain a service animal. It's normally, the program may have a form or they may just ask you for records. They want to know, does the person meet the criteria? So they're asking typically for diagnosis. And if the patient says that's okay, go ahead and give that to them. When a patient is asking for employment or housing letters, they can't access that without a letter from you. And you're basically using the definition of disability, which is not the same definition that Social Security uses to get money. This is, I have a physical or mental impairment that limits more than one major life activity. So it's not the diagnosis that rises to the level of disability, it's the functional level of the person that is qualifying them. So it's not a legal term in the sense of financial benefits. The reason for employment, we talked about it, employment has no reference to service animals. So to be able to get that as an accommodation, I need a doctor for my letter. For housing, we're seeing it for service dogs in training because they're not fully trained, and I need a letter from my service dog in training to live with me or an emotional support animal. Service animal best practices, these are the things we talked about. I'm not going to go through this list. We're talking about communication. We're talking about training. We're talking about engaging your staff because they have stories that you don't know that will help make you more compliant. What you accept is what you can expect. What we're trying to do is balance the rights and responsibilities of the service dog handler with the healthcare facility and other patients who don't have service animals and may object to them being there. So hopefully we have a fair amount of time for questions.
We do. And Jan, do you want to ask the first question and we will go from there?
Actually, I think Stacy is asking the first two,
Oh,
and then I'll come right after Stacy. Thank you.
okay. So the first question we have is I'm sorry. This person is a disabled person with a service dog, and if they are admitted to the hospital, can a friend bring their service dog to be brought in to see them?
The answer would be yes. And what you're going to do is they are acting as the agent for the handler. And when they're asked the two questions, they can just say, I am bringing the service dog to the handler.
Okay. And what are your thoughts on service dogs accompanying patients in areas such as radiation therapy, which may not be safe for the animals? You kind of spoke to this a little bit, specifically if the patient does not have a companion with them, and who can care for the dog when they are undergoing the test or receiving the treatment.
So this is where advanced planning comes in. I happen to be that person. I would tell you that many people in life are not. It's okay to say we can't do your test today because the dog cannot be in here. We don't allow them because we don't expose them to the risk. I will tell you that there are some practices that I am aware of that put a lead shield on the dog or let them be in the control tower. That is going to be at the discretion of the facility because it is their safety assessment of, is this an exception that they're willing to do? They're not required to if you've determined it's a direct threat. But if you feel you can make a further modification to the policy to help, that is certainly on a case-by-case basis allowed. And I would strongly encourage you to say, and this can't happen again, because otherwise it's going to become a pattern.
Okay, great. This is Jan speaking. Thank you. So we've got an example scenario for you. It's a service dog user, and client is a veteran. So the service dog handler is a veteran who went to a VA clinic for care. They use a service dog for their disability. The client sought care at an emergency room at the VA clinic with his service dog present and saw a doctor who determined x-rays were necessary. They told him that service dogs were not allowed in radiology and told him he couldn't bring the dog in. And he didn't have anyone with him and did not offer any accommodation. He said he couldn't leave the dog alone in the car, and so he was then told to leave. It's kind of similar to the last one that we have that you just gave.
So again, when there are, if it's a planned situation, it's a little easier. When it's an emergency situation, it's more difficult. The facility was within its right to say we don't allow them in this area. From a personal standpoint, was there someone that I saw in the lobby that looked trustworthy because I really needed the x-ray, or do I want to delay care and come back another day and get the x-ray? It's a tough situation. Have what I always encourage handlers to do, and I have a card and I keep the numbers handy. If I'm unresponsive, who gets called so that they know what happens to my dog. And only because I can't remember phone numbers, I have someone who, when I need help, that I can call, and I would have that phone a friend ready, because you never know when you're going to need someone to come and bail you out.
Awesome. So, may a business ask for proof of vaccines required by state law, for example, rabies?
So again, we just talked about that earlier on, and that's the case of the community sound. The DOJ wrote in that settlement agreement, you cannot. However, if you're assessing that the dog looks sickly, the dog bit someone, you're going to get the proper people involved to get that information. So it would be on a case-by-case basis. You can't ask everyone, and there would be some reason that it is a imminent threat to the health and safety of those around them.
Okay, great. This is Jan speaking. Thank you. So this was a question that was asked when we were talking about whether or not the animal can go in the ambulance, in the air ambulance, all of that. And the person said, "So where does the dog go? Who takes the dog? What if it's only you and the dog in a crash?"
So this is why, again, I talk about handlers have a responsibility to have a plan. Facilities, if I'm the urgent care center, if I'm the police officer on scene, if I'm doing a Baker Act, I need to have the stakeholders involved. No, I will tell you 9 times out of 10, the officer in most communities, animal control may or may not be on call all the time because they may not be part of municipal government, being private, but your animal is likely, without a plan, going to the animal shelter, which is very important for people to make plans. Just like if there were a hurricane, a wildfire, and you needed to do something with your dog, if you had a car accident and were incapacitated.
Thank you. So this is Stacy speaking. So this question kind of had a scenario in the beginning and then they have a question. The issue I see is they want the specific task, including the disability. So medical alert is not enough. You have to share a medical alert for migraines, for example, and they place pressure it till you give them or you share your diagnosis. How can you get access without giving in or sharing your diagnosis?
So here's what, when we teach the gatekeepers, what we say is, if the person has given you a list of tasks and medical alert is one of them, you're fine because you've given them enough information. It's when you give it as the sole task, because alert is not an action. So you might say, my dog paws me by alerting to my medical condition. That is the action the dog was trained to perform, and you are not required to tell them what the diagnosis or condition is.
Okay, perfect, great. And this is Jan speaking. So what is the recommendation for people wanting to have a dog on their lap, a service animal on their lap during dental care? And the concern is that the sharp objects are being used in terms of the dental care.
So this is where the partnership between the service dog handler and the provider comes into play. We are actually seeing an increase in dental practices actually bringing in their own dogs for therapeutic benefit for patients. So if a dog has been trained, for example, to lay and put pressure, and that is their task, the conversation, if you saw that picture earlier on, is with the provider. My dog has been trained to lay calmly between here. This is where they're going to go to. And you have to have the confidence of the provider that if they're going to say, well, if they come above this level, I can't safely do you. So it's a conversation, an interactive process, because the dog is allowed to task. The other examples outside of dental, we get a lot of calls. I may get a call from the dentist, from the physician at the hospital, the phlebotomist, the person who puts the IVs in, because the dog is in bed. And that happens because staff like the dog in bed so they know where it is. It may not be tasking, but they know where the dog is when the room comes in. And people are trying to provide medical treatment. The provider has a right to say, I need you to move the animal to a safer area if you want me to perform this procedure. And then it becomes the choice of the person, because they're not going to get the care if the provider cannot feel safe in providing the service.
All right, so this is Stacy speaking. So these are two questions, and I'm gonna probably answer them in because you've kind of already answered these questions, but sometimes people ask a different question, but have the same answer. So what if the handler is not capable for caring for the dog, i.e. a psych hold, or what happens if a person, if that person passes away, what happens to the service animal?
Okay, two different scenarios. So
Okay.
a psych hold, again, if the person has not been adjudicated incompetent and they're involuntarily committed, their rights have not been taken away. So I would encourage an assessment of direct threat. Is the person able to manage the dog? Is their disability such that they can't care for the dog because of the psychiatric condition? Because the staff don't have to do that. If the person passes away, then you're probably going to have a family member or someone on record of who you notify of those situations. And if they don't handle it, probably your only other recourse is to call animal control.
Okay. And this is Jan speaking. This is a little bit different take on the asking in advance if you should bring a service animal. But what if you know that the medical staff have people who are allergic to dogs? Do you need to ask ahead of the visit if you're planning to bring a service animal?
You are not required to give pre-notice, but what I have learned personally is what I think I know about what's going to happen during my appointment is not always what happens. So I typically, when they're confirming my appointment, will say, I am coming alone to the appointment with my service dog. Is there anything I need to know about my care when I come that would prevent me from coming alone with my service dog? And I put the burden on them. That is not a requirement under the ADA. But in two cases where I am very informed, I went back to see a podiatrist after years. He happened, not at the time I had been seeing him, to have an x-ray machine, and then he did. So I was expecting to get an order to go elsewhere. And then the orthopedist had a protocol that at 1 year we take x-rays. And I didn't have a person with me, and I offered to come back another day. Um, it's really important. You won't know, but if you're letting them know in advance, you can solve the allergy concern. And they should have protocols, because if you'll know if it's a sole office, only one provider.
This is Stacy. We had a question about feeding the animal. Who would be responsible?
The handler is responsible for feeding, walking, animal relief, any supplies they need.
Great. And this is Jan speaking. So this is kind of a differently worded question. I'm not exactly sure what it's getting to, but it says in ERs, hello? We need to mute that. Yeah, thank you. In ERs, triage is used. So for delays, how do you differentiate if it's for the reason of the animal or because it's just a delay, I guess, in ER triage?
So I'm assuming we're talking about not the service dog handler being triaged, that they're visiting with someone. I'm going to make that assumption because I don't have enough information. So if it's not the service dog handler, if they're the person accompanying the patient who's being treated, it is not uncommon that visitors, all visitors, not just the visitor with the service animal, may be asked to wait until things are stable and they allow them in. It has to do with temporary restricted access based on what's happening medically. I will tell you an interesting training. We helped Tampa General Hospital, a large health system, and during the training, they talked about the challenges in the ER. And security during this training, and this is why training and conversation is so important, says, well, you know, we have a crate that we don't use for our security dogs. And the ER said, well, if someone's unresponsive, could we at least put the animal in the crate and deal with the medical emergency until we can solve the dog problem? So I think people need to start talking internally. Is it an unresponsive patient? Is it treatment that can be delayed until someone else is found? Or is it emergent treatment that you have to deal with it at that moment?
But this is
Right.
Stacy. This is
But
Stacy. Can the doctor write a letter that states this person has a bona fide disability requiring a service animal with no actual diagnosis info because of HIPAA?
Okay, this has nothing to do with HIPAA. So if this person wants some sample letters, we write sample letters for doctors all the time. And it basically goes like, I've been treating this person for how long? They have a disability as defined by, we list all the laws. These are their functional limitations. And that at least gets them in the ballpark. But and again, most doctors' offices live in the world of diagnoses. And for this work, we don't want to disclose diagnosis. You can also, in absence of a letter, request your medical records. I know a number of situations where the VA won't write letters, and so we just ask they get a copy of their medical record. They redact with a black pen anything they don't want to be seen, but enough information makes the case of what the issues are.
right. And this is Jan speaking. This may be our last question. I'm not sure in terms of what time we need to wrap up, but there's a question that says, can you speak to an instance where a staff person has a service animal in a healthcare facility? How would that impact the facility?
So first of all, a staff member would need to have an accommodation under Title I. The parameters of that accommodation will be spelled out very clearly of what needs to happen. Again, as I said, there had been the case where the nursing student was not permitted to have their animal. So we're seeing some recent case law that may change how employers look at it. But the issue becomes, I know of a hospice case where a social worker had a service dog and how they handled it. They had their office and they made sure the patient and the family was comfortable with the service animal accompanying them. I know a psychiatrist that actually has a service animal. And so he lets patients know, I have a service animal during our treatment sessions. Is it okay to be there?
Thank you so much for that. This is Stacy speaking. So we realize that many of you may still have questions for our speaker and apologize if you did not get a chance to ask your question. Please contact your regional ADA center at 800-949-4232. Please complete the evaluation for today's program as we value your input. We want to thank our speakers today for sharing their time and knowledge with us. And thank you for attending today's session. Have a great day.
Thank you, everyone, and thank you, Laura Lee.